Men of a certain age with waterwork trouble naturally assume it's their prostate. But the real culprit is often hiding in plain sight, causing unnecessary heartbreak. In my day-to-day job as a GP, I've seen lots of men misdiagnosed, getting nowhere with their urinary symptoms because everybody's looking in the wrong place. So today I want to show you an easy way to tell if it's your prostate or your bladder. The hidden reasons your bladder might be betraying you, and what I've seen work for my patients. This is your bladder, which is essentially a bag of muscles that fills with urine. That gets bigger and bigger the fuller it gets. And when you need to go, this stretching sends a message to your brain basically saying, "Can I go please?" And your response is usually, "Sure, in about 5 minutes when I get home." Now we'll look at what a bladder issue looks like in just a minute, but first, let's look at a prostate problem. Bladder, prostate, urethra. As you can see, the prostate forms a ring around the base of the bladder, where the urine comes out. Now, as you get older, the prostate gets bigger and bigger naturally, but it doesn't just get bigger out this way, it actually gets tighter and tighter, squeezing harder on the base of that bladder, making the tube to pee out of essentially narrower. So this is what a prostate issue looks like, where the grip at the base of the bladder is tight. When you go for a wee, it might take a while to get the flow moving. Then when you do, the flow is quite weak. It takes a long time to empty the bladder, and at the end, you're not quite sure whether it's fully there as a little bit of dribbling is still happening. Now let's look at what a bladder issue would look like. So we've got a bladder full of urine and a stretched muscle. But rather than sending a message to the brain asking for permission to go to the toilet, instead, it does this. To hell with this, I'm going now. So you can see how this is a symptom of a sudden urgency that you gotta go to the toilet now, or else you're going to have an accident. And this is often missed in men because the focus is on the prostate, simply because he has a prostate. Now this is called an overactive bladder or Detrusor Instability. And a number of tests done at the start are actually to rule out other things, like blood work for prostate and kidney function, urine tests for infection, and scans to check the kidneys and the bladder. But to specifically diagnose overactive bladder, you need different tools. Now, often this is as straightforward as keeping a simple bladder diary and tracking your toilet habits, but it could be as complex as cystometry, which is where a catheter is inserted to measure the pressures inside the bladder. But at the end of the day, if you feel you gotta go to the toilet and you gotta go now, then you've probably got an overactive bladder. So why is this? If there are faulty nerves supplying the bladder as a result of a neurological condition like strokes, MS, Parkinson's, or even diabetes, then the faulty nerves can set off a spasm. But more often than not, the cause is, we don't know. But there are certainly 3 groups of factors that make it a lot worse. Let's start with your pelvic floor. This is a group of muscles that work against your bladder and hold it in place. They're the muscles you squeeze when you need to stop weeing midstream. Now, if these muscles are weak, those little spasms that the bladder has are more likely to cause you to leak. It's like having a weak dam against a sudden surge of water. Secondly, and this is where most of my patients are guilty to one extent or the other, are bladder irritants. These are the everyday things we consume that wreak havoc on our bladder. And there's quite a few. Caffeine is the biggest culprit. Yep, tea and coffee, even decaf, are not only diuretics, meaning they make you produce more urine, they're also bladder irritants, making its lining more sensitive and prone to spasms. Alcohol also causes these issues, but I bet there are a few you haven't heard of. They include spicy food, acidic fruits like citrus, and even artificial sweeteners can also trigger bladder irritation. And don't forget carbonated drinks. They add to the pressure in your bladder. And then there's water. And this is a tricky one because drinking too much will put more strain on your bladder. But the trap a lot of my patients fall into is drinking too little. Because concentrated urine is an irritant for the bladder and actually will make it squeeze more often. So what do you do? Now, very importantly, I'm going to contradict myself in a minute. But before I do that, a summary for how you treat an overactive bladder in one way is as simple as avoid all the things I've just said. So, avoid irritants, drink regularly, exercise and strengthen your pelvic floor. By the way, there's a link below for that. As simple and all as that sounds, it actually works wonders for my patients if you do all of that properly. But there is a group of exercises we mustn't forget. Remember, the bladder is a muscle, and muscles can be stretched, trained, and exercised. Bladder retraining is all about increasing the time between bathroom visits. You start by tracking how often you go, and then slowly extend those intervals by just a few minutes each day. It's like training for a marathon, but for your bladder. You're training your bladder to hold more and wait for longer. It's like going back to the balloon. At first, that balloon is stiff. It's hard to blow up. But with stretching and exercises, it becomes more compliant and easier to manage. It's hard work. It takes several weeks to see any improvement, but with a lot of strong will, it does work. More information on bladder retraining in the description below. And then of course there are drugs which do work quite well, like solifenacin, tolterodine, oxybutynin, which all act to relax the muscle of the bladder wall. But often these drugs come at a cost. They're notorious for causing things like dry mouth, constipation, blurred vision, confusion, and even falls. An alternative to this is mirabegron, which is far less likely to cause those symptoms, but it can raise your blood pressure. It's never simple, is it? Now this is the part where I contradict myself, because the video title suggests to fix this problem you need to ignore your prostate. Well, often it's not as simple as your prostate or your bladder. I find that the two of them actually often coexist. And quite often, this ends up with us talking about the PSA test, a prostate cancer test that is full of doubts, flaws, and uncertainties. It could be the best thing you ever did, or it could be the source of endless, unnecessary worry. If you want to find out a bit more about that test, have a look at this video here, because it's important to make the right decision about whether you get it or not. Hopefully today has been useful. Hopefully I'll see you over there, and thanks for watching.